Okay, I just have a few housekeeping items to run through before we begin. So, as people are joining us, let me just share a bit. First of all, hello, welcome, good afternoon, good morning, good evening, depending on where you're joining us from. My name is Andy Smith. I'm the lead content writer here at Kontakt.io, joining you from a brisk and blustery New York City today. Um, we are really excited to be rolling out this new programming of webinars. Perhaps you joined us on Tuesday for our Transforming Acute Care Top 5 Healthcare Trends for 2024. Um, if not, uh, stay tuned. At some point in the webinar, I'm going to add my contact information and a calendar for further webinars, and I can share the recording from Tuesday's webinar in the chat. Once we get started, I'll get around to that. But I did want to also make mention of a few of the forthcoming webinars. All of these webinars occur at 1 p.m. Eastern. Next Tuesday, we have Dr. Rhonda Collins, Chief Nursing Officer, joining us for a webinar on the complexity of nursing, unlocking high-impact, low-cost solutions to support and empower nurses. Next Thursday, the 25th, we have a webinar called Making Hospitals Safer in 2024, which will explore integrating wearables and AI technology to provide rapid response to workplace violence and ensure the safety of our frontline workers. On Tuesday, January 30th, we have Measuring the Many Benefits of an Optimized Workplace, which is with Adrian Weidgant, our Director of Smart Buildings here at Kontakt.io. And then I won't get too much into February. I will mention February 6th, we have a webinar on maximizing your hospital's supply chain, and many more to come after that. For those of you who are just joining us, I will drop some of these details in the chat as well as my email, so you can always reach out if you have any questions or suggestions. Speaking of questions and suggestions for this webinar, if you do have questions come up, please drop them in the Q&A chat here, and with time permitting, we will dive into those, or I can follow up with you directly down the road. Okay, so today, we are talking about quantifying ROI, measuring the value and impact of improved medical device management. Before I turn it over to Kapil, I did want to just set up the agenda. Uh, Today, we're going to look at what actually is asset management, especially with consideration to healthcare operations, cost of business. We're going to look at some of the value drivers, where savings can be found, where there's opportunity, and not just why you should care, but who should care. What real world data we have that is evidence of the ROI that comes with proper asset management solutions, with respect to, of course, the turning savings into top line revenue. That said, I'll turn it over to our subject matter expert, Kapil Asher. Take it away, please. Thank you for joining us.
Thanks, Andy. Quick sound check. Can you hear me okay?
Yeah, you sound great. Excellent.
All right, perfect. Good morning, good afternoon, good evening, everyone. I'm speaking to you from equally cold Boston. So, there's snow on the ground, there is dryness in the air, and it's really cold. But I couldn't be more excited to talk to you today. Um, I've been in many webinars where I'm hosting the topic of asset management in the context of real-time location sensing. And I've also heard from many speakers who are probably much bigger experts than I am in this field. But so far, I've never had an opportunity to really define what asset management means. In our world where we talk about real-time location, we usually focus on things like dots on a map. How can I search for equipment? What type of attributes can I put into the software so it gives me a quicker result. But no one really talks about asset management. How does it affect the hospital, right? So here is a definition, and I think it's an excellent definition for asset management. I didn't write this myself. I did some research to figure out what true asset management involves in hospitals. So I'll read it aloud to you. Asset management in hospitals involves the systematic planning, monitoring, and optimization of physical assets such as medical devices, facilities, and IT equipment to ensure efficient utilization, maintenance, and cost effectiveness in delivering healthcare services. So, as you can see, there are a lot of things to unpack over here. It all starts with systematic planning. So, it's day zero and your hospital doors have just opened. How do you know what type of equipment and how many pieces of equipment do you need, right? So, there's a lot of science that goes behind planning capital budget and allocating it towards purchasing something which will be helped for healthcare services, and then making sure that they are utilized in an optimized manner, right? We are workload balancing it sufficiently that not every piece of equipment that comes in is utilized at their maximum efficiency. And we're not just having things come in just for keeping a stock of it and not really utilizing them at all given time, right? And then at the same time, making sure they are maintained efficiently, they are in good operating condition at all times, and they're not trailing behind in certain maintenance cycles, which would make them unusable. So there's a lot more involved. There's a lot of capital purchase decision, planning, maintaining, all of that thing is involved in a true efficient asset management program and not just dots on a map, right? So why does it matter? What role does efficient asset management play in hospital economics? So we are all privy to newsletter headings such as what you're seeing on your screen today. Healthcare is by far the most expensive consumer goods and services in North America right now. And it's sharply risen in the last 20-25 years. If you can see, it started here and now it's like 227% more expensive than it was in year 2000. And it's steadily rising beyond any other consumer goods and services that we can think of. Um, I'm sorry, Western modern first world countries are spending a lot more money on healthcare than their counterparts. And even within that, United States is spending a lot more than the next country that spends on healthcare, which is Germany. And all of this is attributed into many complexities. So I'm not going to say that asset management is the only thing that's driving all these costs. Of course, there's increased labor costs, cost of capital. I can't go through and whole accounting lessons why this is expensive, but it all adds up. Every penny adds up at the end of the day, right? So we are trying to play our little role in making efficiency at the top front when it comes to using labor and capital equipment. And that's what I'm going to talk to you about today. And how can you generate some return on investments that are made in modernizing your asset management program? And where do you find that dollar amount to help you with other areas of the hospital? Who should care? It's always a great question. Like, who in the hospital should worry about this, and who should take the initiatives to take, you know, invest in asset management programs, right? So it all starts with materials management. Materials management are our procurement wizards. They are the ones who are counting money. They are the ones who are counting dollars, and they have KPIs, they have budgets that they need to meet, right? So, using industry standard practices, the CFO gives them a budget to spend on capital purchases, and then it's up to them to make sure they are uh, frugally using that money to provide a certain level of service that the hospital is well known for. Then there's clinical engineering. These guys are heroes who make sure that the equipment is in good operating condition at all times. You don't want something to be used on a patient that's not calibrated or maintained in the right manner, and God forbid has some downstream issues after that. And then the third pillar of that equation is internal supply chain. Our delivery personnel who are responsible for distributing equipment, picking up dirty equipment, and making sure they are in a sterile, condition, good working order. So they are the ones who are the arteries of the hospital and trying to pick up and deliver equipment in a timely manner. And eventually, our favorite nurses are the consumers. They are the customers of the other three pillars that I just spoke about. They are the ones who are eventually going to use the equipment. So now, while they are the customers, they also have a fiduciary responsibility to make sure that they are not indulging in wastage behavior. They're not indulging in frivolous behavior where things are going unchecked when they are making demands. So it's kind of very important to make sure that the nursing trusts the other three departments equally, and it's a mutual contract between them. It's a mutual understanding between them, so that the hospital as a whole benefits from their friendship, if you will. So let's dig deeper into each of these departments and each of their functions. Let's start with the clinical engineering. So very simple terms put, like clinical engineers are responsible for preventative maintenance. Every device has a manufacturer recommended maintenance frequency, mostly a year on high volume equipment like IV pumps. Each year they have to be maintained per the manufacturer's recommendation. So you can imagine how clinical engineers are constantly trying to look for devices that they have to work on in order to maintain them. Maintenance is just one of the things they do. There is repairs, there is recalls, there's software upgrades, there is cybersecurity threats. So you can imagine that the clinical engineers are constantly looking for things that they have to work on. There are multiple studies that show that average 200-bed hospital may spend about 2,000 man hours on a conservative side just searching for mobile equipment that they're supposed to work on. So if you take that, average it down to 365 days, it's almost 5 hours every day. So just imagine every morning you wake up and you take 5 hours to just look for your laptop so you can start working. That would be a giant waste of time and a massive economic drain, right? So this is happening times five people, hopefully in a clinical engineering department, times 6,000 hospitals in the whole country. So it's a $1 billion+ problem. Um, Being behind PM cycles is not just that you are, you know, kind of just behind on your projects and you will catch up eventually, right? It actually has some downstream effects. So at any given time, without the visibility using real-time location sensing, you can assume 10 to 15% of devices miss a preventative maintenance cycle, which increases the risk of malfunction and failure, which leads to inaccurate patient treatment. It reduces the lifespan of the device itself, right? So your cars, if you don't filter change every once in a while, oil change every once in a while, it'll reduce the life cycle of your car. Same thing will happen with the med devices as well. It causes downtime, disruptions. You end up with a miscalibrated equipment. Now you have to correct it and find one which is, and then use that on your patients. It's a massive compliance violation. So I think around 2017, Joint Commission made a mandate that 100% of the devices have to be PM, and you are in violation if you don't do that. Could it cause lawsuits? Who knows? Maybe there is a miscalibrated device that's been used on a patient, which caused the patient's health to get worse. That could lead to a lawsuit. And overall, it's not great for the patient experience, right? It leads to lower HCAP scores, and we know how they are tied to reimbursement, so you can lose on the top line revenue as well. Let's talk about internal supply chain. So we spoke about how it affects clinical engineers and how it could drain on the budgets of the clinical engineers. But let's talk about internal supply chain. This is my favorite slide because I always get fascinated by how medical device supply chain operates within the hospital ecosystem, right? And that too without visibility at times. So imagine your Amazon truck has no idea where they are supposed to deliver their packages every morning, and they're just kind of doing that blind. Or worse, they have to pick up something from the UPS store for a return, but they have no idea how much equipment I have to pick up. Is the truck size okay or not? Do I have enough people to haul the packages back into my truck? There are, the same analogy is being used in hospitals. They are doing everything blind completely. So nurse makes a request. Either they make a phone call, or if they're a modernized hospital, they fill a web form to make a request. It gets picked up by supply chain personnel. They deliver the equipment. The nurse uses that equipment, and once they're done with that equipment, either they leave it in the patient room, or they would wheel it to a closest storage closet over there, right? uh, at the same time, the supply chain personnel has no idea that there is a pickup in this location over here. So that dirty equipment, that unusable equipment sits dwelling time for hours at end, right? While the supply chain is still extensively rounding and doing other deliveries and other pickups in other area, those pieces of equipment with the nurse first ordered is just sitting in an unusable condition. So what happens is, while this is sitting in an unusable condition, there is another nurse on another floor requiring the same thing, but they have no idea that just a floor down, there is an equipment they could pick up. So they keep frantically calling supply chain, and supply chain does not have enough to deliver over there, and it just spirals into a behavior which is called hoarding. So nurses would feel like supply chain does not have their back. They don't have equipment to give me when I need one. I'm just going to keep this piece of equipment for myself, and life will be good. While okay for stopgap, hoarding is not a good practice overall, because it increases your need to purchase more equipment as time goes by. Um, so imagine nurses keeping things for themselves, and some good stewards of the process are not hoarding things for themselves. They keep complaining there's a shortage, I need more equipment. They go up to the CFO, and the CFO says, fine, I'll buy you more equipment. Is that good practice? Most likely not. So materials management comes into play. It's a big nightmare for them if the distribution and pickup of equipment is not happening in a timely manner. Because on day zero they start with a certain amount of high volume equipment like pumps, but on 6 months down the line they get bombarded with all these requests, and they go and buy more. And the year down the line, they go and buy more. So they keep buying and adding to the fleet of equipment that was not necessary. And as a result of which, about 65 to 70% of these pumps are not utilized at any given time. It's a massive waste of money. Uh, Moreover, equipment is lost, right? So equipment gets lost within hospitals, four walls of a hospital, or they could even exit the hospital in the form of, let's say, small telemetry devices get lost in soiled clothes, they get lost in trash bays, and up to 7% of those devices could be lost annually. Um, and then there is the problem of short-term rentals. So because of all the loss, because of all the complaining from the nurses or from other clinical staff, sometimes the materials managers just go and do a short-term rental on the equipment, and then they forget that they have the equipment in house, or worse, they don't know where the equipment has been floating in the hospital, and when it's time to return it back, they just have no idea where it is. So they incur late fees on a rental cost which was not needed to begin with, right? So there's a lot of kind of wastage that happens, which materials managers deal with on a almost daily basis. Um, how does nursing come into picture? So let's talk about nursing. It's kind of self-explanatory, right? Nurses are the users of these devices. They are the ones who are going to use them at any given time. But the problem is they spend about 6% of their shift time in hunting and gathering. So if you remember earlier on, they have a supply chain personnel supporting all the needs for medical devices. But if they don't trust that they're going to get what they want, They will either hoard or they will take matters in their own hands and start hunting and gathering on their own. 6% of shift time is almost 45 minutes when you consider a 12-hour shift. And I was doing the math just for fun. If you multiply that times the number of nurses over the whole year, that equates to 23 full-time nurses. So they are actually spending the equivalent of 23 full-time nurses on just hunting and gathering, which is an absolute unproductive task that they are taking on, right? Um, that is the amount of time they could be spending on patient bed care, which is, we know that when nurses spend more time with the patients by the bedside, that always helps with improving NPS, HCAP scores, and giving reimbursement money back to the hospital. Moreover, there is a massive problem with nurse shortages in modern history, like the biggest one in the modern history. So 20-30% of annual nurse turnover, which is what hospitals are dealing with right now. So if you are one of those hospitals which is already dealing with more than, I mean, less than ideal nurse count per patient bed, this is important for you. You can't be losing 6% of shift time in an already understaffed environment when it comes to nurses. Uh, then it's also kind of becoming a challenge to recruit new nurses, and things like modernizing, searching for equipment, things like staff safety, providing wearable buttons, which Andy said we will talk about in the next week's webinar. These things matter. These are used as tools to attract recruiters. I mean, sorry, nurses to recruitment, and this will help you retain talent much more than the hospital that's down the road and not using these modern technologies. So all of these things matter when you are pressed to work with less staff, but you have to over deliver when it comes to patient care. So where to begin? Everyone asks me this question. You know, there are 30 different directions hospitals can take to start trying to calculate an ROI for better asset management, right? Some department will say, I lose wheelchairs all the time, but is that important enough to start, making efficiency? Probably not. Wheelchairs are not that expensive. They are a nuisance when they are lost, but is that where you will get the best bang for your buck? Is that what is going to appeal to the C-suite of the hospital, to the CFO, that you help save maybe 5 or 10 wheelchairs every year? Uh, yeah, but not that great. So where do we begin? Where do we start creating the big impacts, the big multiples of ROI that will then help you fund with these little projects, to help your particular department, right? So what we recommend is always start with IV pumps. IV pumps are large volume devices. There are 2 to 2.5, maybe 3x the number of patient beds, in quantities. And they are the biggest culprit when it comes to low utilization, right? So start with IV pumps and show them a quick win, show them a quick win of 10, 15x return on investment. And then they will gain the confidence of expanding that system into other things which are more, uh, uh, more important to you as a department. So how do we do IV pumps, right? Like, so first of all, we stop stocking in patient rooms. We don't need IV pumps to be stocked waiting for a patient to come in. They could be made to use at all times. There's no need for them to be just sitting idle waiting for work to be done. Then we try to move to a centralized distribution model with par levels, right? So we find a spot where we house IV pumps at all times and we distribute the IV pumps where they are needed. We maintain a clean par storage area on all the nurses' units. So when they need something, they just go to that clean par area, pick a pump, and we monitor that par level. As it falls below a certain threshold, we send a request to the supply chain to restock that par level. And in bargain, the nurses, all they have to do is they wheel the pumps into a soiled room once they are done. And we will be monitoring that soiled room as well. So as it goes above a certain threshold, we'll direct that supply chain person to go pick up that pump immediately and not let it sit for hours dwelling unutilized. So by doing that, by giving the supply chain personnel work to do in purposeful rounding manner rather than extensive rounding, they can spend more time on cleaning, reprocessing, making sure that parts are stocked at all levels. And overall, doing that for 3 to 6 months will help you gain your utilization by 20-30%. And then you decide what you want to do with the extra pumps that you have. So it's always helpful to start with high volume, high impact things like infusion pumps and gain that hard dollar ROI right away. Then the second thing we do is we eliminate loss. So I'm sure everyone on the audience side have seen the scenario where there are busy laundry rooms with so many linens and scrubs and hospital gowns, and it's very easy to lose something as small as a telemetry device in there, and then you lose that equipment forever. So we can start with creating alerts for loss. We can start enabling laundry staging areas, trash staging areas, and make sure when a cart full of laundry is coming and it has a little needle in the haystack of a device, we can alert someone to go retrieve it before it's too late. This is hard dollar ROI. And then finally, think about, I'm just doing a quick time check. Think about improving maintenance management programs, right? So, what do you do with that saved time now that you're not spending that extra 2,000 hours per year? What do you do with that? You can invest that in advanced learning, enable your teams to learn about skills that they didn't have the time to learn before, and you were outsourcing that work to at a very high paying outsourced biomed program. You can start doing that in house and save some money that way. Um, think about predicting failure before it's too late using advanced AI. Now that we have all this data of usage, location, we can feed this AI engines that can predict a failure way in advance. So you can uh, provide some preventative failure measurements rather than a repair later on. And then transcend data silos, right? Data does not have to be stored in one system like Kontakt.io. There is a lot of freeness in data. So we can automate things like work order management, record keeping. We have where asset trackers which have buttons on them. By press of a button, we can automate a creation of a work order rather than having to call or fill a web form, and just make the efficiency much more valuable for everyone. And once we get through all of that, there is just no limit to how much ROI we can create from a system like this. So actually, speaking of ROI, let's do a simple calculation here. I have this sheet which I've named simplified ROI. We do have a model which is much more complicated, and we take real-time data from our customers and we feed that model to give you a true number, but this is a simplified version of it. So let's take an example of a 340 bed hospital in a Midwestern city in one of the states in the Midwest. And we are developing this for the VP of Materials Management. A typical hospital of this size would have 2.5 times the number of patient beds for IV pumps, so 850. And that's an average cost of what it takes to buy an IV pump. And then there are seven devices per patient bed. That's the rule of thumb we use, seven mobile devices per patient bed, which should be tracked and tagged at all times. So that those are these devices. It would have a team of four biomed engineers, which would be spending 3 hours each looking for things on an average. They would have a team of four supply chain members who would be walking around distributing and picking up equipment. And they would be doing that for 6 hours every day per shift. And they would have 170 nurses daily on shift who were spending, like I said, 40 minutes per day looking for things. So once you add up all these costs, or you add up the time spent in looking for things, and multiply that with the hourly or the unit cost of these things, would lead to a savings of about $3.1 million in year one. And then over 3 years, which is our standard minimum contract value, which is $7.5 million, and over 5 years, it will be much over $12 million. Um, I'm not exposing our costs on this, but if you need to know the actual costs of what our systems would take, you can absolutely send Andy an email and we can go deep dive into the costing structure. But when you look at the ROI, just in year one, you would get about 14.61 times your investment when you are buying things from Kontakt.io, and you would achieve break even in merely 3 months. And every month you delay doing this service, I mean, buying this service, you are spending about $884,000 per month to do that. Now, I know I'm brushing through this very quickly, but we can provide one-on-one free service to understand your environment and give you a truer number of ROI for your specific programs. But this is available and it's as true as it can get. So let's go back to my deck over here. And Andy, I know I'm almost at time, but I'll just take another 2 minutes. Why Kontakt.io asset management solutions? Like, why do hospitals like to work with us and spend time with us? We are easy to use. We are a completely cloud hosted platform. We don't require any cable pulls to install our infrastructure. We work with your existing access point infrastructure if they are Bluetooth Low Energy enabled. So coming in, deploying, and leaving the hospital after validating the whole system should not take more than 2 to 3 weeks. I know it's unheard of in our industry, but that's a proven way of installing and enabling your hospital. We provide the fastest ROI. So ROI is not starting at the point of go live. ROI starts at the point of purchase order. So if the time between purchase order and go live is 6 months, 8 months, that's not helping your ROI. You need to be able to deploy it as soon as possible, which accelerates your time to value. And then finally, unmatched scalability. So we are one-third the TCO of any leading asset management company in the US. And we have unmatched scalability. We can start with assets. We can go into saving staff from getting, faced with workplace violence. We can help with efficient patient workflows. There's just no end to how scalable we are when it comes to anything to do with location services within hospitals. And it always acts as a springboard for other investments. I'm not going to spend time talking about it as we are nearly at the end of our time here, but you can just see kind of a matrix of all the different use cases we provide. We start with medical devices. We quickly move to enable staff with feeling safe and providing hand hygiene compliance. And then the holy grail is where the patients come in when we provide with wayfinding so they don't have to wait for their appointments. We help process them through different phases of care in a much faster, efficient manner, and all of which leads to more turnovers and higher revenue at the top line. And that's it. Andy?
Wonderful. Thank you so much, Kapil. That was quite a lot of information, but you did an excellent job of moving us through it. I think what's excuse me, what's most interesting for me is, not just how Kontakt.io solution is easy, fast, and scalable, but kind of to your last slide, asset management is has a quick ROI that's very measurable, and then it acts as a springboard for so many more use cases.
Absolutely.
So thank you again for joining us. We are a bit over, so I'm gonna call it. I did include my email and a link to the webinar's calendar page in the chat. We are currently looking at webinars every Tuesday and Thursday at 1 p.m. Eastern. Hope to see y'all again at a future webinar. Thank you so much for joining. Thank you, Kapil. That was really wonderful, and have a great rest of your day. Thanks,
Thank you,
everyone.
guys.
Bye.
Bye.